Kevin Chow. Very
Hey.
nice to have you here with us at Intermedics Summit 2017.
Certainly.
Good. Glad you've had the chance. You want to actually introduce yourself?
Yeah, my name is Kevin, and I'm with the Mission Department of Health and Human Services in the Bureau of EMS, Trauma and Preparedness, and I work in the Division of Emergency Preparedness and Response.
Cool. So you have a number of Intermedics products, right?
Yep. So in our office, we have 5, and I manage 3 of them, EMResource, EMTrack, eICS, as a state administrator, and then we also have the Coruscant and the volunteer eServIt product as well, which is managed by 2 other coordinators.
And so you've had these over a number of years. I believe since 2004, 2005.
Yeah, it actually initiated sometime in around 2005 on a smaller scale, and then we transitioned to having it managed by the state. I think it was like later in the years, like 2009 or something like that. But it went statewide. Originally, it was kind of set up for each of the regions in Michigan.
So you've been with the agency almost that entire time.
Yeah. I started the agency since 2005.
So do you remember kind of when first rolling out the solution, some of the original reasons and rationale behind it? Like, were you using technologies for any of the initiatives for patient tracking, for HaveBed and things? Were you using any technologies before that, or do you remember what the?
Yeah, when the program started originally after 9/11, so about after 2001, in 2002 the office was established, and at that time the Department of Health and Human Services, the federal government, they developed a bioterrorism program. Hospital bioterrorism program, and within that program, they had very clear identifications as it relates to what are the type of capabilities we need to establish. And one of those things was like bed tracking with the HaveBed, and also electronic patient tracking. So in 2005, we started to investigate what were the best products, and at that time, it was with EM systems and with EMTrack for patient tracking, electronic patient tracking, and then bed tracking with EMResource. Yeah.
So there really wasn't much technology before.
No, not really, because we were still a very young agency, and we obviously had solutions in order to capture that. But it wasn't very intuitive. Sure. So yeah.
So do you remember what things were like when, for example, you had to try to gather HaveBed information in 2005? What do you think that was like before?
Honestly, when I started in the program, I was involved with the Mission Health Alert Network, so with the HAN product, right? And at that time, I wasn't really in-depth involved with bed tracking or patient tracking, but as my responsibilities grew, I took that leadership into evolving into that subject matter expert. So honestly, at that time, it was just basically querying our partners, identifying their bed status as it relates to the bed categories that the HHS wanted to have.
Sure. What's the difference in your mind between what EMResource can do and what the Health Alert Network does? Because you have a really unique perspective, starting with the Health Alert Network and then seeing where EMResource has gone since. Yeah.
So the HAN, the Mission Health Alert Network, and EMResource, obviously focus on 2 different capabilities. But I certainly say EMResource has dramatically improved since we started to manage it at our state level, as it relates to the technology and as it relates to other types of technology compatibility, like with smartphone, the smartphone apps, web-based, and then the ability to link accounts through some of the products. So there's this dramatic improvement that currently exists.
So what's your favorite? Is there any one?
I would say with EMResource specifically, obviously the real-time data that we have access to when we have to alert hospitals provide bed status updates or other type of incidents or events on EMResource, right? The notification features that you can be notified with text or with email when you activate an event, I think those are very good. And I think as I'm thinking about it, I would say the best part about it is the configuration, because we can configure it based on our needs. And I think that's one of the best features about EMResource is the flexibility for us to configure our events and how we want to have it related to what we need.
You've also done something a little unique in that you've empowered your regions, right?
Oh yeah. Yeah. So like, for example, we have certainly expanded our activities with healthcare providers, right? So it was a big focus with hospitals. Now we're expanding to long-term care facilities, and also we have it with dialysis centers. And those are critical because, as we all know now, in the next new 5-year grant period with CMS, we have a listing of 16 type of healthcare disciplines that need to be integrated with preparedness, and we'll more than likely be utilizing EMResource to expand that with those healthcare disciplines.
And I assume that's the flexibility and the power.
Right.
That
Yep. That's an example of flexibility because we can identify different type of bed categories related to long-term care, and we can identify different type of data elements related to dialysis centers. And now, so with the ability to do it both web-based and then also with smartphone, somebody from somewhere can still be able to participate with exercises or actually during a response, remotely. Yeah.
Talk me a little bit about EMTrack, and I know that was another one that grew from some regional utilization, and it eventually became a statewide initiative. Talk.
Yeah, sure. Yeah. So when it started out, we provided somewhat autonomy for each of the regional coordinators to determine what best fit their healthcare coalition, right? And I would say it was a growing pain type of thing, where different regions had different type of products in place. And what we discovered is that it was great to give them that decision making at the local level or the regional level, but it created challenges of sharing information at the state level, where because people were using different products, it was difficult to have that similar awareness with one product. So the decision to make EMTrack statewide and discontinue different type of platforms was obviously a good decision. Because it encompasses everybody at the local level, regional level, and the state level with the same product. And if there were a transition of people going from one region to the other, we're on the same product. So yeah, I think that particular decision was obviously very big.
How do you define or describe interoperability?
Yeah, so interoperability is basically being able to communicate, communicate seamlessly with, same type of data elements, similar products, because if you have folks utilizing different tools, it will be a hurdle to have the same type of understanding, right? But interoperability is like, okay, we're talking about communications products, which could be radio or satellite phone, things of that nature. But as it relates to real-time data, interoperability is important with having the same type of product and then understanding the same type of data elements that exist.
Is there one specific scenario that you can think of where you used one or more of the technologies in a real world event?
It's daily. So if we're talking about EMResource, the regions utilize EMResource when there are incidences going on, such as a large vehicle accidents, right? They would create an MCI alert. And then obviously that communicates to all the stakeholders such as EMS, such as hospitals, and a regional healthcare coalition or their medical coordination center, okay? So if we're talking about EMTrack, we're talking about EMS agencies and hospitals in the same area being notified and knowing when patients are arriving from an incident. Okay, these things are happening on a daily basis when it's needed. So we're not just using these products just for the purpose of preparedness, but we're using it for daily operations. And the other piece is with eICS, of course, where a lot of our hospital systems use it for their incident command. And they use it for a lot of purposes because they're replacing it from what they previously were using as a mechanism to share information internally at their hospital facilities and their hospital health systems.
And talk to me a little bit about Grand Rapids. We start, their use of the Grand Rapids Region
Right.
6, of course,
Sure.
using EMTrack on really a daily basis.
Right.
That's unique.
And that is an example. With a lot of in the case of Kent County, for example, they do a lot of runs. All right, we're talking about thousands of runs per year, and
EMS transport.
EMS transport, yeah, specifically. So EMS transport. So what they have been able to integrate is EMTrack, and then also with EMResource. So each time there are EMS agencies within the Kent County Medical Control Authority, when a run occurs, it gets initiated with EMTrack, and it creates an alert with through EMResource. And so the hospitals know the patient and these specific types of data elements like male, gender, triage level, and then they'll know ETA time when it comes to the hospital. So they get that awareness. So it takes away other layers of communications, like taking away some of the dispatch needs to perform rather than having to call in, which they still obviously do if they need to, but it's more electronic based where they're monitoring the information through EMTrack and through EMResource.
What role do you see ENTRMEDICS playing in supporting a lot of those initiatives with kind of the daily advancement
Right.
of the products?
Yeah.
And just the general role of ENTRMEDICS kind of as the domain expert?
Sure. So obviously ENTRMEDICS for us is a partner in all of this, right? And I think what ENTRMEDICS has performed specifically for EMResource, EMTrack, and eICS is that your team and your product manager and developers do a good job of a continuation of improvement. And I'm going to add that your improvement is also based on end user needs. So when I attend, your user conferences, I explain, what are the type of things that are important for us. Okay. And every year that I've attended, I've noticed a lot of improvements that has been performed, and that's something that I would certainly say is a very good relationship, because you're not just like sustaining. You're continuing improving, but you're also getting feedback from us as the partners to drive the product. And one of the things that I would even highlight when there was a session related to eICS, and one of the things that Mary Lou, the product manager, was talking about, a roadmap of what's going on, and we talked about HVA, right, and developing an HVA in eICS, which I think is going to be something that would be very helpful, especially with the current new 5-year block, where the healthcare coalitions has to perform an HVA on an annual basis. So that's something that's great, but it's getting feedback from us, and like I said, that continuation of improvement.
And seeing the results actually come.
Right.
Yeah.
Oh yeah. Well, I mean, it's like we have to see the end results, because that is something that's practical, and it can be operational right now.
So if you could imagine, and I don't mean to bring it down, but what would life be like without some of these technologies? Like, what would life be like without EMResource?
Well, it would be challenging. I think that one thing is that EMResource or EMTrack, eICS, it has been fairly integrated with our preparedness and response culture. Okay, so our partners are familiar with the products. We know how to utilize it, and certainly we're ready and prepared, right? So if we didn't have it, obviously, we have to find alternatives, but it would be challenging. It would just simply be challenging. But if there wasn't EMResource or there wasn't EMResource, eICS, EMTrack, we just have to figure out another solution, because we still have to meet our expectations.
Cool. So one, and I know it's always a challenge with preparedness to talk about like a return on investment. Do you feel like some of these technologies have really proven their worth and demonstrated a not necessarily a financial, but benefits that really return on what you've invested, both from the technology side and from growing and adopting the platform?
Yeah. Oh, certainly. I would say the ROI is definitely is there. It's we have been using some of these products since 2005, and we're in 2017. So we've had that partnership for 12 years, right? And if we felt like the return or the results was not there to meet our program needs at the state of Michigan, and if we don't have our, not meeting our federal partners' needs with the HPP program, with the grants, the grant capabilities and so forth, then we would not be here, right? So the return on investment is definitely there, and I think I would also add, as it relates to financially, is that realistically, the grant programs, there is always the concern of reduced grant funds, and I think that EMResource has done a fairly reasonable job in understanding that and to support us related to reduce of funds. And I think that as we continue that relationship and that partnership, and if that necessary adjustment occurs, then we want to work and make that happen. So, but that's just what it is.
Yeah.
In the federal government and the grants.
What do you see? That brings up another interesting question. What do you see as the future? You've clearly read the next, the next phase, and what are your thoughts? What do you see coming?
Well, so my thoughts is that certainly we have new expectations, new capabilities, and we are certainly going to be expanding some of our activities related to the CMS 16 disciplines. Highlighting the big items, right? Dialysis centers, long-term care facilities, rural health clinics, federally qualified health clinics, and many others. There's 16, but just highlighting some of those top ones, right? We will certainly be working with those healthcare disciplines along with integrating the current products that we have in place. It's going to be a new 5-year grant period of new challenges. But challenges that I think that we're very comfortable and ready to proceed on, and hopefully that relationship with our program and with with EMResource will be continued through that time as well.
Very good.
Yeah.
I asked some of our other colleagues about this, but what's the one preparedness or response threat maybe that keeps you up at night?
Well,
or your favorite emergency, your favorite type of
right.
disaster.
Other than Aaron Rodgers of Green Bay, well, I think that as long as we have a good program that's in place and being able to continuously support the most important people, which are the folks that are obviously on the front line, with first responders like EMS, or the folks that provide the patient care, at long-term care facilities and so forth, that we certainly need to be very supportive for them, and making sure, like for example, properly training them with interoperable communications, or with plan developing, emergency plan development, and training, and obviously with exercising. So with those activities, training, exercising, education, All those things are what we have to do, but then how do we go on doing it, and how we go on doing it are some of the tools and products we have in place. So I would say my biggest concern is just making sure that people are ready and prepared. And that's a big spectrum of expectation. But I think that as long as we have that good partnership with the folks at the local level and regional level, that we can certainly be able to meet those expectations, so I can sleep well at night. Yeah.
Very good. I think that's my question. So Kevin, thank you very much
Yeah, no
for
problem.
the opportunity to interview.